Bonjour. صباح الخير. ميرسي الله يعافيك.
الله يعطيك العافية.
محلك.
تفضلي يا
Our community entails both Syrian refugees and host communities. The peer support is run by the psychologist, and it's not only about discussions and topic, but they also go into different activities. Depends on the interest and the demand of the beneficiaries. It can be literacy classes, physical activity, yoga classes, cooking classes, meditation. So it depends very much on each center and on the interest and demand of the beneficiaries, because at the end of the day, what we really want is to engage them, to get them out of their isolation, and to start empowering them within their own communities. We are implementing a project for the older people, Syrian refugees, as well as host community that are affected by hypertension and diabetes. This includes support in the consultation, support in the medication. We provide patient education and awareness about the behavioral changes that needs to be done. If you have diabetes, hypertension, or you have a chronic vascular disease, if you don't take your medication, then you are at a life-threatening condition. And who has the chronic disease? These are mostly older people. So if you don't bring your medication with you, or if you don't have money to go to the doctor, you are left without any assistance. So now we are walking to the center where we run the psychosocial activities. So this is another center that is for our partner Maqasid Association. We are not establishing any new health facility. We are supporting our partners to strengthen their own facilities to provide services, which we do believe that this is more sustainable. And this is being implemented for older people to tackle their psychological distress and to improve their psychological well-being. So far, what is being reported are more cases of depression. So many centers where our psychologists are practicing, they are taking these cases and trying to work with them. Many times, we were not able to bring the Syrian refugees from the informal tented settlements or camps to the centers. So what we did is that we started activities in the camps. Some of the older people have physical impairment, so it's difficult for them to come to the center. And sometimes they are afraid to go out because they don't have their legal permit. The refugees have this particular need of engagement in the community. They are somehow isolated, and they have this specific condition of distress because of the war and of the displacement. Once they engage in this program, they get out of their isolation, they have their own somehow self-esteem back. The respect, the dignity of older people. At any time, this should be the main concern. In crisis time and in humanitarian context, older people have the lifetime experience. They have this resilience. They can face problem in a different way. It's true that they are in a vulnerable situation, but they have their rights to be respected. And maybe this should be the concern of the frontline workers and should be really highlighted in the community. In our culture and for these people, dignity is a must. This is sacred. You just really need to be fully aware of this. You need to be culturally sensitive. We're only supporting them. We're only just providing a little bit of support to help them see the bright side. We are not instigating this. This is coming from them. This assistance is helping these people to keep going and to look in a different way at their situation, not only to look at the vulnerability, to look at the future.